My name is Joseph Edwards, and I'm going to be going over Chapter 12 in the textbook, which is on students with physical disabilities. So for a quick overview, students with physical disabilities are as unique and capable of anything that a student who doesn't have any physical disabilities can do. They're just as intelligent, and they're just as capable of achieving any great thing. And they need special accommodations in certain situations just to make sure that they are capable of getting the same learning experience out of their education. And so for a couple of the possible causes of physical disabilities, sometimes they can occur from accidents, they can occur from substance and child abuse, neuromotor impairment such as cerebral palsy, spina bifida, and brain injury. Often it's an issue or some kind of impairment in their brain function or in their spine function, which will cause them to become a student who has physical disabilities. Other additional causes are fetal alcohol syndrome, juvenile rheumatoid arthritis, seizure, and AIDS. Um, there's a lot of different things that can cause a student to have physical disabilities. And as a result, there's a lot of different uh, accommodations that need to be made for them. And so for a couple of the characteristics of a student who has physical disabilities, orthopedic impairment is the most common IDEA classification, but they can often be classified in the more broad other health impairment. And as I stated earlier, the intelligence of these students has the same range as students without physical disabilities. And then, as I've also stated earlier, there's quite a range of behavioral and learning characteristics that accompanies these physical differences. Some examples of that could be weaker and stronger modalities, different interests, and varying levels of academic performance. And then so some of the classroom challenges and implications of having a student with disabilities in your classroom. Um, Physical differences in the condition's severity influence student stamina, which in turn affects school performance and behavior. Frequent hospitalization may affect educational and social progress. Students may require medical attention during school from school health personnel, such as a nurse. Um, and then it's important to be certain to provide accommodations that honor the student's level of performance, interest, and stamina without diluting curriculum expectations, meaning that these students, if they are given the correct accommodations, are and should be considered just as capable as any other student. And then it's very crucial that the teacher, you as a teacher, communicates and collaborates with the student's parents and any other involved health professionals. And then so strategies for learning and inclusion, I included two on each slide. The first being is learn how to effectively include any adaptive devices with the student with physical disabilities might use, such as alternative keyboards, computer control switches, a voice recorder, a cushion chair, hearing and or vision devices, adaptive scissors, alternative writing tools, and slant boards. You can also use more low-tech options to help these students too, as using certain technologies could make it more difficult for them. An example of this is if you are in an English class, say, you can tape down a paper that the student is writing so it doesn't move if the student doesn't have a very steady hand. And then another simple thing that you could do is provide very cushioned and comfortable seating in your class, such as like a beanbag or a very cushioned chair. And then a few more strategies. If you have larger writing tools and certain grips that you can put on pencils, this can allow students who have difficulty writing to write easier and write longer, making it much more possible for them to write essays and do assignments. And then another thing you can do is incorporate open and verbal discussions in class. This means that you could focus on having verbal discussions over what you're teaching as a way for students to engage with the material. That can include breaking them up in their tables or doing it as a whole. For students with physical disabilities, usually this is something that they can do without any other necessary accommodations because it's just verbal communication. Um, but there are, of course, some that have, special needs that do affect their speaking, and so obviously you can incorporate other different measures to accommodate that. And then lastly, you should strive to make your teaching environment as inclusive and open to all students as possible. And when you're thinking of your students, you should see them for their strength and not their limitations and work towards building up their strengths. And lastly, you should advocate for your students and work with other professionals to make sure their needs are met.